Welcome back to the Woven Well podcast. As you may know, our main mission at Woven Natural Fertility Care and through our podcast is to educate and empower women about their menstrual cycles, women's health, and fertility so that they can make truly informed decisions while honoring the connection between their fertility and their faith. We want to provide you with all the resources that you need in order to get the care that you deserve. However, why does it have to be one sided or feel so one sided? At some point, I know that we would love for the medical community to meet us halfway and make some of this progress together. And thankfully, that's happening in the realm of restorative reproductive medicine with physicians and medical professionals who take the unique physiological design of women seriously and want to see them healthy and thriving. But we'd love for it to go beyond them too. So, what can we as patients and women do to advocate for the standard of care in gynecology? What are steps that we can take that have the potential to truly make a difference? To discuss that, I've invited Dr. Anita Showalter. Dr. Showalter serves Duquesne University Nasuti College of Osteopathic Medicine as Chair of Specialty Medicine and Division Chief of OBGYN. She applies whole person philosophy to patient care by focusing on nutrition and lifestyle and using hands-on osteopathic manipulation to reduce pain and speed healing. Dr. Showalter, welcome to the show.
Thanks so much for having me.
I'm excited to talk about this and to hear your perspective because you're one of those physicians and instructors who believes that patients can play an essential role in their medical diagnosis and treatment. But that's not always the approach taught in medical school. So I'm curious what led you to that perspective.
The short story is I was a patient before I was a doctor. And when I got pregnant with my first baby, I was so excited and anxious to learn everything about the process and was so fascinated with a woman's ability to grow and nurture her child inside her body. And I wanted my pregnancy and my delivery to be as natural and normal as possible. It was also my worldview that we are a product of intelligent design, and God knew what He was doing when He created the process, that we shouldn't be afraid of it, and that it was much more a um, physiologic process than it was a medical um, procedure.
Mm-hmm.
When I went to my first doctor, I clashed right away
No.
with my ideas about nutrition and what I wanted out of the pregnancy. And I ended up switching doctors, and it went a little better, but still wasn't really what I was looking for. And after the birth of that first baby, I thought it was okay, but it wasn't how it should have been. So that sent me on a mission to learn more. And I was not yet a doctor, but after 4 pregnancies, I decided that that was my pathway to help other women find the kind of care, personalized care that met their own desires and philosophy that was hard for me to find. So that was what led me to medicine to begin with.
Wow. I love that you had 4 children and then felt called to go into medicine because so many of us think that it has to be the other way around. You have to pursue whatever career you want first and then think about children. But it just goes to show if God's calling you to something, then God's timing is always going to be perfect. And so it's not going to stand in the way.
No, He's going to make the way.
Absolutely, absolutely. Well, I appreciate you being open about your own frustration in the doctor's office because I know a lot of our listeners feel that way. There's a lot of gaslighting and just being ignored and dismissed and sometimes belittled and made to feel small. And, we were always wondering, why is that? Why is the standard of care for women's health specifically so minimal, so low? Why is the bar so low?
Well, we are a product of our training.
Hmm.
And medical school is very intense, and you don't have a lot of time to research everything yourself. You have to believe what you're being taught. And so, unfortunately, there's a lot of tradition that goes along in medical training. And sometimes it can take years for the research to catch up with medical practice. So that's one of the problems. Another problem is just the time, because medical care has gotten so financially oriented that everybody's on the clock. Um, Most physicians are not the owners or managers of their practice anymore. They're beholden to their employers for their paycheck. The way medical reimbursement happens, most doctors are told you can only handle one problem at a time when a woman comes in or a patient comes into their office. Well, most problems are much more complex than that, especially in the area of reproduction and fertility.
Yeah.
So the doctor is shackled by the policies that they work under, and often are as frustrated as the patient. So I want people to hear that most physicians went into medicine with a true heart to serve,
Yes.
and then found themselves in a system that is working against them for that.
Mm.
So that's part of the problem.
I really appreciate you mentioning that. And I think it's so helpful for us to keep that positive perspective. Earlier in the year, I actually posted something on our Substack called Fertile Faith about how you can go into a doctor's office and help set them up for success.
Mhm. Yes.
Because they do, like you said, have time restrictions and limited resources, and they're not trying to hold things back, but they're working with what they have. And so how can you partner together to be more successful in that appointment? And sometimes it's easier and sometimes it's harder. um, but it also explains why so many doctors just jump to recommending birth control pill, because it's an approach to
Yes.
any problem almost, that's like, okay, well, let's throw this at it and see what happens.
Well, because the birth control pill takes over the cycle, it fixes almost every cycle symptom.
Mm,
Now, it doesn't fix the underlying problem,
yeah.
but it fixes the symptom. And we're trained to find disease and fix the symptom more than we are designed to lead a patient to health. And
Yeah.
actually, my attraction to osteopathic training was it starts with the idea that we partner with our patients to find health, not just identify disease. Now, that's easier said in a philosophy than it is to work out in the office, but at least that's the mindset that we go into it with. And
Yeah.
so, if a patient is also knowledgeable, like you said, setting up their physician for success by learning body literacy, doing cycle tracking, understanding what their cycle is doing, and not just looking to the physician for an answer, they're going to be able to get more out of that appointment. Now, with the understanding that the doctor has not been trained to evaluate your cycle tracking. So you may need some help from someone who's trained to do that, and then go to the doctor already with some ideas about what might be going on.
Yes, absolutely. And that's honestly our goal at Woven Natural Fertility Care behind the scenes of Woven Well, is that we want to provide that education and empowerment to women to help them when they walk into the doctor's office, and to be able to use it on their own for family planning and, just living life as a woman, to feel like that is a good and positive natural thing. But to really feel like when they walk in, they know what they're talking about, they understand their body, and they can advocate for the care that they deserve. Absolutely. I'm a firm believer that we can be a part of the change for good.
Yes.
That women, that patients, we can be a part of moving progress forward and keeping women at the forefront of that. Obviously, we are not within positions of power within women's health. We're not high up. We're not in medical schools. We don't own hospitals, things like that. But we are women, we are patients, and we are in the doctor's offices every single day working with these physicians. So I appreciate you saying, chart your cycles, use a method of fertility awareness, and be a voice in that room, have something to say and offer. Do you have any other ideas for ways that patients can help advance the standard of care within their own work with their physicians?
Um, I'm really encouraged with how much information is coming out, not only in women's health specifically, but health in general, like nutrition, um, focusing on whole food diets.
Mm,
Good news, nutrition is going to be part of every medical school training from now on. And so we're going to see some really exciting things because, um, God made food to feed us and nourish our bodies, and we can use food as medicine.
yeah.
And so a woman who takes the time to learn about whole foods and how um, over processed foods harm us. So you can eat a diet that looks pretty healthy, but if you actually read the ingredients, you may find that it is not doing for you what you had hoped for.
Hmm.
And the obesity epidemic, our chronic disease rates all point to there's something systemic going on that's bigger than one person's food choices.
Mm,
And it has to do with food policy. It has to do with what companies are allowed to put in foods. And so the more you can educate yourself on that and make the hard changes. So I had my own little health situation I've been dealing with for the last year, and decided to get some assistance from a functional medicine doctor
hmm
that approaches disease from a uh, cellular model. And I was shocked with how quickly my baby weight that I'd held on for 40 years came off. 40 years. And when you're dealing with infertility, being overweight and polycystic ovarian syndrome and all that has to do with the ratio of fats that we eat in our diet. And you have to know about that, and you have to make the choices to avoid those foods, which means you read every single label and you do a lot of your own cooking
hmm
in order to gain that.
Which is tough. It is tough to get that education and to learn more about it. But in another way, it's also encouraging and empowering too, because what I hear you saying is the doctor's office is not the only place where you can
Yes.
get information about how to improve your quality of life and your physical health. And
Hmm.
so the physician has a very important role, but it is not the sole way that we can learn more and get the help that we need.
Exactly.
That's great. Well, thankfully, I also see that the medical community is making some changes. The fact that you just told us that nutrition is now going to be in every medical school, you may have seen that I chuckled because I'm thinking, the fact that nutrition is not in every medical school already is a little mind blowing to me. But I know that there are a lot of improvements happening. There are organizations that are contributing to this change. And I know that you're a part of those, as am I. But can
Yes.
you tell us a little bit about what's happening kind of on a larger scale to fuel positive change within the medical community specifically? Give us a little hope here.
Well, first of all, I'm so excited to be part of Duquesne University, who decided to start an osteopathic medical school because they felt that that was a way to move forward their own mission. Um, but they also, I'm getting ready to leave tomorrow to Italy, to the home of the Mediterranean diet. And this is a program that Duquesne University has had for their health professions students for the last 10 years. And we're going to include osteopathic students in that as well to learn how to use food as medicine and how to encourage longevity and health by lifestyle and environment. Also, I've heard the Italian doctors give food prescriptions to their patients. And we're going to learn about that. And that's exciting to
That
me.
is, yeah.
Yeah. So, but it really can make a dramatic impact in your health.
Mm,
So, there's a lot of positives out there.
mm.
So I think anybody that might be discouraged can take hope.
Absolutely. I have the privilege of working with some medical students who need to observe a fertility awareness method class
Hmm.
through facts about fertility.
Yes.
And that organization I have so much respect for as well. And they are very intentional to spread more and more education. And any medical student can do this online elective course if it works
Hmm.
within their program and can learn about all the fertility awareness methods and how they can be used to hopefully help to diagnose those underlying conditions and empower the patients. And I've met with all sorts of medical students in different fields, and I'm like, tell me why you're interested in this. And it almost always comes down to, well, I didn't have any of these options, and I want to make sure that it's different for my patients, which is what got you into the medical field in the first place. You had a negative experience, and so you wanted to change that for future generations. So, who knows, listeners? The Lord may be inviting you into some area of change. You never know, but that can start in simple ways like through charting your cycles. Well, Dr.
Yes.
Showalter, thank you so much for being on the show, for giving of your time and expertise, and for encouraging us today.
And thank you so much for educating your listeners, and God bless your work as well.
Thank you. Listeners, I want you to know that even on a personal level, I know what it's like to be ignored or dismissed in the doctor's office. That has most certainly happened to me. I know what it's like to feel frustrated and stuck and like there's nothing you can do to make a difference. And this is why we want to explore this together. We want to face it head on. We want to talk about it openly because there is a problem in women's healthcare today. But there are things that we can do. We can be agents of change. Our words and our choices and our actions can make a positive impact. And if you're a client at Woven Natural Fertility Care, we also make sure that every single medical referral that we make is to a physician or clinician who understands this struggle and values the unique physiological nature of the female body. We make sure it's someone who will not just throw the birth control pill at you for any issue or tell you just try IVF. We're about real solutions to very real problems, the problems that you experience on a daily basis. And you deserve no less than quality, dignified care. So, if you'd like to learn more about our work or some of the organizations who are working toward the advancement of women's health research and care, we'll have links in the show notes for you to check out. As always, thanks for listening as we continue to explore together what it means to be woven well.